McMillan, and I am a nursing student at Indiana State University. Today, my presentation is going to be on colorectal cancer screenings, men and women in the African American community. The objectives: to define colorectal cancer, to identify the population at risk, to identify the signs, symptoms associated with colorectal cancer, to identify the test screening parameters, to identify screening barriers, and to identify preventive measures to reduce the rate of colon cancer in African Americans. Ask questions. Number 1. At what age should colorectal screenings be done for African Americans? Number 2. What are the signs, symptoms indicating possible problems with your colon? Number 3. Can any of the colorectal cancer screening tests be done at home? Number 4. Is colorectal cancer hereditary? 5. Are African American men at greater risk of getting colorectal cancer than African American women? 6. Name 3 barriers in the African American community that prevent early detection of colorectal cancer. 7. After the initial colonoscopy, what is the recommended time frame for a future follow-up procedure? 8. What is a polyp? 9. Name one of the colorectal screening tests. And number 10, is colorectal cancer preventable? What is colorectal cancer? Colorectal cancer is the 4th most cause of cancer diagnosed in the U.S. For African Americans, it is the 3rd most common cancer, which accounts for about 50,000 deaths per year. This type of cancer is found in the colon, known as the large intestine, or rectum, and is also referred to as colon cancer. Before colon cancer develops, it usually begins as a non-cancerous polyp. A polyp is an abnormal growth of tissue lining the colon or rectum. When polyps are removed, it lessens the possibility of getting colon cancer. The cause of polyps are unknown, but researchers think they can be caused by hereditary or lifestyle factors such as a decrease in physical activity, diets high in fats but low in fruits and vegetables, and use of tobacco products. Other medical factors that increase the risk of getting colorectal cancer include being diagnosed with inflammatory bowel disease like Crohn's disease or ulcerative colitis, having a family history of colon polyps or colon cancer, or even being diagnosed with a genetic syndrome of familial adenomatous polyposis or FAP. Populations at risk. The population with an increased risk of colon cancer are African American men and women between the ages of 45 and 75. This is due to lack of knowledge of the benefits of having colon screening exams, access to care, cost associated with screenings, lack of interest, not being recommended by physicians for screenings, diet, and sedentary lifestyle. The normal age for colorectal screenings begin at age 50, but for the African American population, it is recommended at age 45. When detected, it has been statistically determined that the colon cancer rate was higher in the African American population at a younger age than in any other population. Symptoms. There are several signs and symptoms that would alert a person to possibly having issues with your colon, to include having bloody stools, rectal bleeding with bright red blood, narrower than normal stools, unexplained abdominal pain, unexplained changes in bowel habits, unexplained anemia, unexplained weight loss, and weakness and fatigue. So if you experience any of these symptoms, it does not necessarily mean you have colon cancer, but you should seek medical help to determine the nature of the problem. Screening tests. There are several different screening tests that can be done for the colorectal cancer tests. There are the stool test, the flexible sigmoidoscopy, the colonoscopy, and the CT colonography, which is a virtual colonoscopy. Colorectal screenings. African Americans are less likely than non-blacks to have screening tests for colorectal cancer. They are also less likely to have colon polyps detected at a time when they can easily be removed. African Americans are more likely to be diagnosed with colorectal cancer in advanced stages when there are fewer treatment options available. They are also less likely to live 5 or more years after being diagnosed with colon cancer than other populations. The barriers associated with screenings are due to lack of knowledge about the test, the lack of time and interest, the cost, insurance issues, and fear of the colorectal cancer screening results. There are also physician barriers that affect the early detection rate of colon cancer in the African American communities. For instance, not recommending colon cancer screenings, lack of knowledge for screening guidelines, as well as lack of time. African Americans can take several actions to help reduce the colon cancer rate in their communities. These include learning about the benefits of being screened, getting pre-screening examinations for early detection, incorporating a healthier diet to include more fruits and vegetables, and decreasing saturated fats and red meat consumption, implementing more physical activity on a daily basis, stopping or decreasing tobacco use, and following up with physicians on a more regular basis. These are the references that I chose for my presentation. They were from the CDC, Center for Disease Control and Prevention, the ASGE, which is the American Society of Gastrointestinal Endoscopy, and then also from the NIH, which is the National Institute of Health. Post-test questions and answers. Number 1, at what age should colorectal screenings be done for African Americans? A, 30, B, 40, C, 50, or D, 45? The answer is D. Signs, symptoms indicating possible problems with your colon. Select all that apply. A, headache, B, blood and stool, C, painful stomach aches that are not relieved, D, swelling in the lower extremities, E, rectal bleeding, or F, unexplained weight loss. The answers are B, C, E, and F. Any of the colorectal cancer screening tests be done at home? A, yes, B, no. The answer is A. 4. Is colorectal cancer hereditary? A, yes, B, no, or C, it depends on if the patient has a family history of polyps or colon cancer. Are African American men at greater risk of getting colorectal cancer than African American women? A, yes, B, no. The answer is B. 6. What are some of the barriers in the African American community that prevent early detection of colorectal cancer? Select all that apply. A, cost of the screening test, B, lack of time, C, insurance coverage, D, lack of interest in being screened, or E, lack of knowledge concerning the screening benefits. The answers are A, B, C, D, and E. After the initial colonoscopy, what is the recommended time frame for a future follow-up procedure if no abnormalities are found? A, 1 year, B, 5 years, C, 10 years, or D, 7 years? The answer is C. 8. What is a polyp? A, ulcer in the colon, B, abnormal tissue growth lining the inside of the colon, C, hemorrhoids, or D, a type of colon screening test? The answer is B. Name one type of colorectal cancer test that can be done at home. Answer, stool test. 10. Is colon cancer preventable? A, yes. B, no. The answer is A. Thank you all for taking the time to watch my presentation, and I hope you all were able to get something out of it. Thank you.